Hi, I'm Emma Phillips, Head of Safeguarding Partnerships for North Yorkshire, and I'm going to give you a quick presentation to give an overview of our recent 3-week Joint Targeted Area Inspection known as JTAI that took place at the end of January, beginning of February of this year across North Yorkshire. The focus of this inspection was on our collective multi-agency responses to children, including unborn children who are victims of domestic abuse. The inspection predominantly focused on children under the age of 7. JTAIs are carried out under Section 20 of the Children Act 2004 and are a thematic inspection of our multi-agency arrangements. They focus on the quality and impact of assessment, planning and decision making in response to notifications and referrals. They look at how we protect children and young people at risk of specific types of harms or the support and care of children who are looked after. They also look at the leadership and management in place to support practitioners to respond to this form of harm and assess the effectiveness of our local safeguarding arrangements in relation to this work. This particular theme relied upon strategic alignment and governance overseen by both North Yorkshire Safeguarding Children's Partnership and North Yorkshire Community Safety Partnership. JTAI inspections are carried out from inspectors from Ofsted for Children's Services and Education, from the Care Quality Commission or CQC for health providers, for His Majesty's Inspector of Constabulary and Fire and Rescue Services, HMIC FRS for policing, and His Majesty's Inspector of Probation, HMIP for probation. Indeed, for this inspection, we had 15 inspectors who visited over 35 different sites across North Yorkshire and spoke to over 250 different practitioners about the work they do to protect children under 7 in relation to domestic abuse. The scope of the inspection focused on the definition of domestic abuse from the Domestic Abuse Act 2021 and explored our multi-agency responses under Working Together to Safeguard Children 23. Inspectors evaluated how statutory partners, so police, local authority and health, worked with probation, education and early years providers, as well as the voluntary and community sector to identify and respond to children who are victims of domestic abuse. Inspectors evaluated the multi-agency arrangements in relation to how we respond to children who are victims of domestic abuse, both at the point of identification, but also including assessment, planning and decision-making in respect of responses to notifications and referrals for children who have been victims of domestic abuse. They also looked at our ability to protect and support and care for children who are at risk of or have been victims of domestic abuse, and also how we work together to prevent children from becoming victims. Inspectors also evaluated the effectiveness of the local partnership through how our multi-agency safeguarding arrangements monitor, promote, coordinate and evaluate the work of statutory partners. This included a focus on practice largely over the previous 6 months. Just for wider awareness, I've included the definition of the Domestic Abuse Act as set out, and have hyperlinked into this presentation a fact sheet developed by the government for colleagues who want some further information. As mentioned earlier, this inspection crossed strategic governance for both North Yorkshire Safeguarding Children's Partnership as well as the Community Safety Partnership, and incorporated partnership work by a number of different organisations, as highlighted on the slide you can see now. The inspection triangulated information from a number of different sources, as well as meeting with key practitioners and partnership leads. They undertook a series of case tracking. They renewed 12 months worth of management information, and that included things like meeting minutes, strategies, some of our policies and procedures from a partnership and from an individual agency perspective. They asked the partnership to complete a multi-agency audit of the 6 cases that they'd done a deep dive audit upon, and requested the production of a multi-agency thematic learning audit. They also analysed our ability as a partnership to identify risk and respond appropriately, as well as exploring wider safeguarding around kind of domestic abuse and the leadership of staff working in this area. Following the inspection, the report was published on the 28th of March, and partners are working together to review the findings and develop a formal multi-agency action plan. This will send back to Ofsted ahead of the deadline of the 9th of July. In terms of the multi-agency audit, the multi-agency audit group found that the responses to children who are victims of domestic abuse were strong. The group recognised the challenges in working across such a large and complex geography, but felt that the relationships between multi-agency partners and information sharing across the partnership was good. I've included on the slide an overview of some of the key findings from the audit. Voice of the child. The audit group saw some excellent examples of how voice of the child was captured in records, including PPNs or police protection notices that articulated the experience of the incident through the eyes of the young children who were present. This really helped to articulate the lived experience of that child. Similarly, there were excellent examples of how the voice of the child came through case recording and through the work, particularly in education and early years settings, through the observation of play and artwork, etc., for signs of distress or trauma, particularly in very young or non-verbal children. Professional curiosity. The multi-agency group also saw some excellent examples of professional curiosity being shown. For example, despite a mother stating that she had no contact between her and a previous partner, the observation by a worker of a pair of size 9 trainers in the family hallway during a visit led to that practitioner submitting a safeguarding referral. This quick-time information sharing resulted in the child now being supported through a child protection plan. Colleagues are reminded around the latest practice guidance around professional curiosity on the North Yorkshire Safeguarding Children's website. Neurodiversity. The audit identified a significant correlation between both victims and perpetrators of domestic abuse and neurodiversity. This is likely to impact on the ways in which families work with professionals and consideration of the needs to be given by professionals to how we tailor the work that we do with neurodivergent families and how they then understand the impact of domestic abuse on their children. Responsibility for safeguarding. The audit recognised the strong multi-agency involvement in the cases within this audit and recognised the challenges for many victims of domestic abuse, who in this case were all mothers, in managing the trauma they'd experiences, as well as the high expectations on them to safeguard their own children. Opportunities for joint working. Whilst the audit saw good examples of multi-agency working, the opportunity to come together as partners to undertake joint visits, etc., was identified as a benefit, especially for families who might struggle with engagement or find being introduced to new professionals difficult. Meeting attendance. The audit found that engagement in child protection meetings and MARAC meetings was good and there was good information sharing. An area to strengthen, however, is to ensure that minutes of those meetings and/or outcomes of safeguarding referrals are received by all agencies and are saved accurately on partners' case recording systems. This enables all partners working with the family to have a whole system, whole family view of the work that's been undertaken with the family. School holidays emerged as a theme within the audit that we undertook, and we found that a number of domestic abuse incidents occurred either just before or during school holiday periods. We recognise that this is a time where there may be increasing pressures for families in terms of finding childcare, increased costs, etc. And it's also a time when there's a change in routine and children are not necessarily in school or education or early years settings. Support for children is provided across North Yorkshire over the holidays in programmes such as the Feast programme. However, we did recognise that there may be opportunities to strengthen the work we do with our voluntary and wider community settings and how we share this information with families to provide wider support over holiday periods. North Yorkshire Safeguarding Children's Partnership will be considering some wider campaign work alongside colleagues in Community Safety Partnership and colleagues such as IDAS to help promote some of the available resources over the partnership over the coming months. Early years and school settings. The audit found some strong trauma-informed work with children in early years and school settings, and there's a need to ensure that they're included in meetings related to children. On occasion, schools can be invited, but there's a need to also make sure that we're including early years settings for younger siblings too. The audit found some excellent work undertaken after Op Encompass notifications were made to the school following a domestic abuse incident, which led to robust safeguarding action taken, in one case, for example, where a mum had shared that she hadn't followed the safety plan. Operation Encompass. There were some really good examples of Op Encompass having an impact on children in education settings. However, currently, not all early years and school settings are signed up to this process. North Yorkshire Safeguarding Children's Partnership will be picking up a piece of work with police to support our early years and education settings to sign up to Op Encompass, as this has been identified as good practice within this audit where it was used when a domestic abuse incident had occurred. North Yorkshire Safeguarding Children's Partnership will also be supporting an early years safeguarding conference early next year, which will include training around domestic abuse. Domestic Abuse Disclosure Scheme. The audit found that information shared at multi-agency meetings was good. The group also found that the Domestic Violence Disclosure Scheme, or DVDS, also known as Clare's Law, was used appropriately where people have both the right to ask and the right to know if a current or ex-partner has a history of domestic violence or abuse. GP records. The audit saw good information sharing with regards to GP records for children, often for mothers as well, that fed into the child protection processes. However, there was often information sharing challenges where either the father or perhaps a partner or ex-partner were registered at a different GP practice. This has been identified as an area of development for the partnership. Adult social care records. The audit welcomed input from adult social care within the audit and could see the interlink, especially where parents may have mental health challenges. Currently, the adult social care recording system doesn't enable the wider recording of family networks or the recording of supervision on case files. This again is an area that is being taken forward for development. Recording of ethnicity and cultural awareness. The audit group saw some examples of excellent consideration of cultural heritage of a family and how this might impact on the family's engagement with the child's plan. However, this wasn't consistent in all cases, and the audit group examined, and there was inconsistency in the accuracy of recording of ethnicity data across the partnership. Information sharing with probation. The audit found there was good information shared with probation service where it was evident that they were working with adults within the child's network. There was a recognition that where this had been most effective was when this was done at the earliest stage, and it enabled attendance at meetings and then information sharing. A probation officer is now sat within our multi-agency screening team, our MAST team. Therefore, future opportunities exist to strengthen the information shared with probation, where there may be children linked to and an adult or wider health information. The audit group, however, did recognise the need for partners to continually keep probation colleagues updated should there be case updates or a change in risk, etc., so that it facilitates that whole system, whole family approach. Children in custodial settings. Partners were reminded of the North Yorkshire Safeguarding Children's Partnership practice guidance around children in custodial settings. For some of the cases we examined within the audit, the parent was in prison, and therefore consideration of the impact of this on the child and wider family network was really important, both now and also thinking about that for the future. IDAS. The work by IDAS with victims of domestic abuse was identified as a strength through the audit. However, where victims might find engagement difficult, considering looking at joint working opportunities, especially if we've got other professionals who are already working well with the family, was considered to be an area to be explored. This was particularly apparent where the victim may also have, say, neurodiversity or other vulnerabilities, and there might be a significant number of professionals involved with that family. Understanding the work undertaken with perpetrators. The audit group recognised that there would be a value in the children's workforce having a wider understanding of the work that's undertaken with perpetrators through support programmes that focus on developing their understanding of the harm of domestic abuse on children. This input will be added onto the agenda of the upcoming Safeguarding Partnership Development Days. Clarity of record keeping. The audit found on the whole there was good record keeping. However, there was a need to ensure professionals accurately record the details of the names of those within the wider child's network. For example, on occasions, records included details of partner or ex-partner. This can make it difficult to understand the nature of the risk posed and to identify any wider children connected to that adult who might need to be safeguarded. This was especially apparent where perpetrators may develop relationships with new partners who may also have children, and/or where perpetrators potentially move across different geographical boundaries. Parental mental health. This was a theme that came through strongly from the cases examined within the audit day, both for victims and perpetrators of domestic abuse. This is likely to have a considerable impact on the lived experience of the child and needs to be thoroughly considered in the children's plan and links across to adult mental health services. It was heartening to see reflected in the case records information shared through the #AskMe campaign being run by North Yorkshire Safeguarding Children's Partnership, as well as the sharing of other key messages such as the ICON message, Infant Crying I Can Cope, and the SUDI, Sudden Death in Infancy. Professional challenge. The audit saw some good evidence of the use of professional challenge, however reflected the need to encourage professionals to appropriately hold others to account and to challenge themselves and one another to avoid drifts in children's plans. The JTAI inspection report found a number of key strengths in their assessment of our multi-agency arrangements, and these included the following. They articulated they were impressed with the mature and respectful relationships between statutory and community partners in North Yorkshire Safeguarding Children's Partnership, the Domestic Abuse Local Partnership Board and the Community Safety Partnership. They saw effective use of a practice model in children's social care and early help as a vehicle for giving families the skills and the insight that they need to protect their children from domestic abuse. They also saw the quality of the direct work with children in helping them to understand what's happening to them and their family. They were also impressed with the preventative work undertaken to help adults resolve conflict over how to parent, for example, when children have an undiagnosed special educational need. They saw early identification of potential risks to unborn children from perpetrators of domestic abuse and were impressed with how partner agencies identified and responded to the vastly different communities across North Yorkshire without losing sight of the strategic priorities for the county. They were impressed with the wide range of statutory partnership services, the commission services and the community and voluntary services that provide support to children who are victims of domestic abuse, their families and adults, victims and perpetrators. They saw evidence of a good understanding of the risk posed by adults and appropriate risk management of domestic abuse by the multi-agency public protection arrangements known as MAPA and through our multi-agency risk assessment conferences known as MARAC. They saw proactive use of the domestic violence disclosure scheme known as Clare's Law by North Yorkshire Police to assert parents' rights to know information as well as their right to ask. They saw promotion of evidence-based prosecutions by the police during criminal investigations to support and protect adult victims of domestic abuse and their children. And they were particularly impressed with the quality and the impact of the multi-agency quality assurance and auditing that we undertake as a partnership. They also found some areas that we need to develop and improve. These were particularly focused around how the experiences of child victims of domestic abuse, particularly those aged 0 to 7, are consistently captured across the partnership. This particularly was evident where the meetings may focus more on the victim or the perpetrator of abuse, and for us to ensure that the impact on the child and the child's voice remains centred to our decision making. The extent to which children are recognised as victims of domestic abuse in their own right across the partnership. This is starting with the formal recording of children as victims in their own right on police systems and the way in which we respond to the needs of children experiencing domestic abuse. Thirdly, the timeliness and consistency of information sharing across the partnership to inform risk assessments and safety planning. The accessibility and take-up of multi-agency domestic abuse training by practitioners and how well that learning is applied in practice. The inspectors recognised that there was a significant amount of domestic abuse training that was available, but wanted further assurance regarding the take-up of this training by frontline practitioners and by managers, and then evidence of how well we understand this learning is being applied to practice. They also wanted to see more effective use of data to enhance our scrutiny, our monitoring and evaluation of services to support victims of domestic abuse. They also wanted to see greater timeliness of Operation Encompass notifications to school and early years providers. The development of Op Encompass across our early years provision to include childminders, nurseries and other settings is a key area of development for us. As a result of this report, we're working with key leads across the partnership to explore these recommendations and to develop a multi-agency action plan. These key actions are grouped into 8 theme areas. Firstly, children identified as victims in their own right and the voice of children in partnership meetings. There are some recommendations for our front door and our multi-agency screening team, our MAST. There are some recommendations in relation to our strategic governance, our accountability and how we utilise our data across our partnerships. Also particularly focusing around our multi-agency training and awareness raising and how we know that the learning and the services we are delivering are having an impact. There's an area of recommendation around our commission services, particularly around commission services for those children from 0 to 7. Recommendations as mentioned in relation to Op Encompass and information sharing, and equally in relation to education settings and the support for children during holiday periods. Each of these actions will be assigned where possible to the multi-agency partnership group with the relevant governance to oversee developments in this area. So finally, in terms of next steps, key partners are meeting on the 4th of June for us to review our action plan, and a finalised draft action plan will be sent to key strategic partner leads ahead of the submission deadline to Ofsted on the 9th of July. Actions will be allocated where possible to the relevant agencies and subgroups, and the progress will be formally reported up into the North Yorkshire Safeguarding Children's Partnership Executive and Community Safety Partnership. So finally, I'd just say thank you for listening to the learning from our JTAI inspection. If anyone would like any further information or any guidance documents or signposting to particular practice guidance, please email us at nyscp@northyorks.gov.uk. Thank you.